If you've ever walked into your poultry pen and seen a bird opening its mouth wide like this, not eating, not drinking, just stretching its neck and gasping, that is not yawning. That bird is struggling for oxygen. And if you ignore this sign, you will start losing birds. Stay with me, because what I'm about to explain might save your flock. That open mouth breathing you're seeing is called gaping. Watch closely and you'll notice something important. When the bird tries to inhale, it opens its mouth wide. When it exhales, no wide opening. That tells you it's fighting to draw air in. This is a classic respiratory distress sign. You may also notice sneezing, rales, that crackling breathing sound, coughing, wet eyes. At this point, most farmers rush for antibiotics. And they are not wrong. But here is where the real problem starts. In many respiratory infections, tylosin is a common drug of choice. So you mix it in water. You treat for 3 to 5 days. But nothing changes. Birds still cough, still gasp, still weak. Then you say, this drug is fake. This supplier sold me bad medicine. But pause. What if the drug is not the problem? What if your environment is working against the treatment? Let me show you how. Have you ever bent down and brought your nose close to your litter? That sharp, choking smell? That is ammonia gas. Now imagine living just a few inches above that floor. Because that's where your birds live. Every single breath they take pulls ammonia into their respiratory tract. Ammonia irritates the trachea, damages the lining of the airway, weakens their natural defense system. Once the airway lining is damaged, bacteria enter easily. Then infection sets in. And even if you give antibiotics, the bird is still inhaling ammonia 24 hours a day. You are treating with one hand and poisoning with the other. That is why recovery becomes slow or doesn't happen at all. Let's talk about litter application. Sawdust is good, but how you apply it matters. If birds are scattered everywhere and you start pouring fresh sawdust over them, fine dust particles rise into the air. Birds inhale that dust directly. Dust irritates the respiratory tract. Irritated airways plus ammonia plus bacteria equals respiratory crisis. The proper method is simple. Shift birds to one side. Apply litter on the empty side. Move birds to that clean side. Then finish the remaining half. Small management step. Massive health impact. If you truly want your treatment to work, do this. 1. Improve ventilation immediately. Open doors and windows. Allow bad air to escape and fresh air to enter. 2. Remove wet litter. Wet litter produces high ammonia. 3. Maintain dry bedding consistently. Prevention is cheaper than treatment. When you correct the environment and give the right medication, birds respond quickly. But if you ignore management, no drug will perform optimally. Respiratory infections in poultry are not just medical problems. They are management problems first. Fix the air, fix the litter, then the medicine will work. If this helped you, share it with another poultry farmer. It might save their flock.